Been a tough time for people in abusive relationships. The pandemic has led to an increase in domestic violence. So what can be done about it? Mary Jane Foster of Interval House and Karen Jarmark of the Connecticut Coalition Against Domestic Violence. They're both with us today. And ladies, thank you so much for being with us here today.
Thank you.
You bet. Thank you.
And Karen, I want to begin with you. So what has the situation been like in terms of domestic violence across our state over the last 3 or 4 months?
So as we would expect, there's been an increase in individuals reaching out to the state's domestic violence hub, which manages through text, email, live chat, and phone contacts. If you look at April, for example, and compare that to June, there were 1,000 more contacts to CT Safe Connect, which is that linkage to the 18 domestic violence organizations in Connecticut. So we're viewing there's increases in people seeking help. 60% of those individuals have never reached out for help before. Lethality assessment calls from law enforcement to advocates is increasing by over 20%. And so what we know, and I know that Mary Jane will be speaking to this momentarily, is that help is available 24/7 from skilled advocates across Connecticut. And it's really important for people to know that they can access that help.
Mary Jane, are you seeing the same thing?
Oh, absolutely. The increase in our contacts, fourth quarter of this year to fourth quarter of last year, is up 58%. I mean, that's over 1,000 more calls that we have received from victims who are looking for advice, for safety planning, for shelter, for all of those things. We have a 25% increase in the number of clients that we have. And we have responded by tasking all of the advocates with making increased outgoing calls. So our advocates have been reaching out to victims they have worked with over the last 6, 8, 9 months, making those calls, staying connected so that folks know we are here, we are a resource, and we can be of help.
You know, Karen and Mary Jane, whoever would like to take this question, do you have enough resources during this pandemic to handle all the demand?
Let me say, Dennis, that I have been incredibly touched by the outreach and the response of the community to the situations in which we find ourselves. They've been incredibly generous, but it has been an enormously expensive venture keeping people housed and safe. And keep in mind, we also have, like Hartford Hospital, we have increased expenses with cleaning and disinfecting and all of that. So we remain needy, but I would really be remiss if I did not thank all of the people who have stepped up on our behalf and on behalf of domestic violence agencies across the state. It really has been amazing.
Karen, can you give us a description, if there is even a way to generalize it, but is there a type of person who usually comes to you for help?
Well, we know that domestic violence does not discriminate. And so we are seeing individuals from all socioeconomic, ethnic backgrounds who seek assistance. And that safety plan can look different for different individuals, but we know that advocates are very skilled and trained to be responsive and develop safety plans that work best for those individuals. I'll just say in terms of resources, we've had to decompress shelters in the state of Connecticut, domestic violence shelters that normally function at 120% capacity, down to under capacity. And so hoteling victims to keep them safe has been a priority in a way that we've managed this COVID pandemic. But as Mary Jane was indicating earlier, the cost associated with that is enormous.
Karen, you're well connected to many lawmakers. What can lawmakers do to help?
Well, I think consistency around funding is enormously important. I know that there are going to be difficult budget discussions in the new legislative session. So holding that line on support for domestic violence services and to consider, especially around lethality assessment and child advocacy support, how we might be able to increase those line items in the budget.
Mary Jane, as a nonprofit, you rely a lot on donations and fundraisers and things like that. It's been a very difficult period with the pandemic because no one's doing these types of things. How has it impacted Interval House?
Well, we have been the biggest message that I have sent out there to our donors, our supporters, our funders, and to the public is this is a time to stay connected. The best, most effective thing we can all do, apart from washing our hands, wearing a mask, and safe distancing, is staying connected. And so we have tried to stay very, very connected to our donors. They've been incredibly responsive. But we all have, across the state, real concerns about what this upcoming year looks like. The economic impact is just beginning to hit us of COVID. We don't know what that is going to look like. We don't know if there will be donor fatigue around helping those others in need. So we are really concerned. We are doing our very best to marshal our forces and to save resources and consolidate, but the need just keeps growing. The other thing that I didn't mention that I really want to say, because it came up at the statewide coalition meeting a week ago, research has shown us that in times of crisis, domestic violence, intimate partner abuse increases both in frequency and intensity. What we have seen as providers of services is an increase in numbers. We are now seeing an increase in intensity and violence, and it's really, truly frightening. So we are in a very, very perilous time. And it's important for all of us to support our friends, family, and colleagues. It's important to support the agencies who are providing these resources and work, and just know that staying connected is the very best thing you could do.
Karen, I want to touch on what Mary Jane just said about the economy. Is there a correlation between a rise in unemployment and domestic violence?
Well, I mean, we know from the conversations that advocates have been having with victims through CT Safe Connect and also within the 18 domestic violence organizations that there are certainly stressors associated with losing a job, food insecurity, uncertainty around the pandemic, and the worry around becoming sick. We're hearing that about 20% more from victims and survivors. Also, having to do clinical consults about 23% more of the time. So definitely in terms of what Mary Jane is saying, that the economy, the pandemic, all of those things compress. They don't necessarily cause the violence, but they can certainly exacerbate the situation. And,
Mary Jane, as I recall it, I should point out that I'm on the Men Who Make a Difference committee, which is part of the board there at Integral House.
And I know thank you.
Well, thank you. Well, it's an honor to be part of it. During one of those meetings, I know you said that there was also an increase in men-on-men domestic violence in same-sex relationships.
We are seeing an increase, still about 3/4 of the intimate partner abuse we see. Men are perpetrators, but the other 25% is split amongst women who are perpetrators in the LGBTQ community. So it is a rise in violence that we all need to pay attention to.
I want to thank
it impacts all of us.
Mary Jane Foster, Karen Jarmark, we thank you so much for being with us. And I know that both of your websites have numbers where people can call, and we'll try to get it on our website as well for anyone out there who's being abused and needs some help right now. Ladies, thank you so much. In a moment, we continue our summer feature on Black-owned businesses in our state. And I welcome your comments on Instagram, Facebook, or Twitter. You can find me on any of those social media giants.